This is Professor Grigsby. This is his 15th year with us at EOU. He received his PhD from Washington State. He is focused on environment, natural resources, political sociology, technology, and international development. Here he helps coordinate the social welfare aspect of the ANSOC program. Before coming to academia in 2000, he worked for 4 years on federal grants, evaluating telehealth networks, practice outcomes. He also served on CASA, the Court-Appointed Special Advocates for Children, and the Grand Ronde the Grand Ronde Child Center. He served for 9 years on those boards. Currently, he's engaging in this community-based research that's helping informing local problems, giving students opportunities outside the classroom to develop marketable skills, and also strengthening potential ties with employers in the process for our students.
Thank you. And thanks, MJ, for getting this stuff ready. And I'd like to thank all the parking attendants who made spaces available, everybody who was involved. Yeah, my PhD training wasn't necessarily in healthcare. But once I took the job here, I sort of shifted into it. I realized I had to sort of come up to speed in some different areas. And I have, over the course of my professional training and scholarship, I've always worked in rural communities pretty much in the States and overseas. So that's really been my passion, is sort of rural community research and as a canvas, as a template. I'm going to talk about a couple of things today. One is the actual research that was conducted. I was sort of the principal investigator. Rosemary Powers was working with the student on literature review as part of that. And the second part is really about community-based research. I'm not going to talk about it too much, but there are some implications here. By the way, Jace, is this working? Yeah, okay. There are some implications for trying to do that kind of work and what it takes for a university to maybe scale it up if there's an interest in doing that. But anyway, for those who are interested in this kind of work, I think I've learned a few things over the course of the last 18 months or so. So I think I already skipped the slide. Oh, okay, so I just wanted to make sure and acknowledge the students who worked on this. And they're all often doing interesting things now. Brent Labhart is in Portland, and he's also doing an online Master's in Social Work program with Portland State University. Mike Reynolds is at Boise State, and he's doing he's getting into med school, so he's doing a post-baccalaureate program to get into medical school. And Crystal Long Ross, she resides in Pendleton, and Crystal is working in the social welfare field in Pendleton. So it obviously wouldn't have been possible without having 3 pretty dedicated students to help do this stuff. So, I mean, I'll talk a little bit about background, how did this all come about, state of the knowledge, research design methods, what we found out, and what it might mean. So, again, this is my background doing rural community research. So it sort of made sense, even though it's not something that I get to do a lot of. Pendleton Academies is the other entity to thank on this. And a lot of you know Terry Edvilson. And Terry Edvilson he is the chair of the board of Pendleton Academies. They no longer function as they used to, which was as a residential psychiatric treatment center for children. The state's not paying for that kind of thing anymore. It's, funding leads the state to move in different directions, and so state kind of went from residential facilities to day treatment, and then to things that put kids into the schools. There was sort of this do we pull them out or do we push them into the school? And there's still debates about whether pushing in or pulling out is the right way to go. But clearly in Oregon, the trend is towards pushing in to the schools. So Pendleton Academies, although they don't do that anymore, they're still very interested and committed to children's mental health in Umatilla County. So they approached the university and said, can we do something? And at this time, I and a few other people were working on this idea of the Center for Rural Studies. So we were looking for ways to do research in the communities and in the region. And this just turned out to be a really nice fit. Terry said the board was willing to give us $5,000, which we used mainly to pay students and defray some of their costs of travel, since the work happened in Umatilla County. So there are these things that I'll talk about, these trends in children's mental health, which also it made this a good time to do this kind of research, because change is afoot. And it's really, most of the change, although budgets are shrinking, is a good thing, because it's more towards science-based programs. And then we have in ANSOCH a capstone requirement for our students, so it just fit really well. I had 3 students, they were seniors, they were ready to start working on their capstones. Center for Rural Studies, I already sort of mentioned that as part of this. You know, if you have any questions along the way, just raise your hand. So this is what Pendleton Academies wanted, you know, assess the accessibility, availability, and acceptability of health care for children in Umatilla County. They never got past the A's, so, and that was still a lot for what we were trying to do with, you know, my limited time, because we don't really have, you know, much of a research appointment, and 3 students who are, you know, they're trying to get out of school, fulfill their capstones, and then they're traveling to and from Pendleton on a regular basis too. So Pendleton Academies wanted to know, where should we invest money? We've got this money, we sold our facility in Pendleton, how should we invest that money in children's mental health care? So, you know, Umatilla County is not a lot different than a lot of rural areas. So in terms of health care, there's a shortage of practitioners. They are a HPSA, it's called, a health practitioner shortage area. Distance is a huge problem, as is poverty. And that's Umatilla County, and I don't know how those straight lines happen in the mountains and things, but clearly not on the ground anyway. So this part here in the middle is the tribal reservation, the Umatilla, and a little bit down here. It takes up a, you know, a substantial portion of the county. Lots of small towns, a few bigger ones, and lots of space, and not that many roads, and you can imagine this time of year how difficult it might be for some people if you get sick or something and trying to access health care. Okay, I had to try that, right? Because it's so much fun playing with the animation. So later on, for those of you who stick around, there'll be a post-hypnotic suggestion. We'll do a couple of these. You know, the three converging trends. The first is this idea of adverse childhood experiences, and it came from a study. Well, I'll get to it. Okay, it came from a major study done by the Centers for Disease Control and Kaiser Permanente. Wraparound initiative, I'll talk about that, and also Oregon's got this new initiative called Early Learning. And this is the ACE pyramid. Peter pointed out that, you know, as a social scientist, it seems like we always have death at the top of something or other. It's always very dismal, but in some ways it is dismal. If you look at this, what this shows is that children who experience these adverse things in childhood have a higher likelihood of dying sooner and having a difficult time transitioning to adulthood. So now the reason it's a pyramid, as you can see over on the right there, because we have scientific gaps. We don't necessarily know what the causal mechanisms are, but what we do know is that kids who experience 1, 2, 3, 4, or 5 of these different kinds of trauma, the more they experience, the more difficult it's going to be for them to make that transition to adulthood, and it leads to all kinds of dysfunction, social and emotional and cognitive impairment, health risk behaviors, disease, disability, all kinds of stuff that makes it really hard for kids. So the idea is, let's get it early. Let's try to detect these problems early on. The study was, so the Centers for Disease Control wanted to do the study, and Kaiser Permanente, which is a large healthcare provider and insurer, mostly in California, they had 17,000 people that they were willing to allow to be involved in the study. So it was a lot of numbers. It was a huge study, and it's in some ways a secret. A lot of people don't know about this study, but anymore it's become more and more fundamental, even to the way people in schools think about how to educate kids and the role of mental health and mental illness in that process. So these are some of those sources of trauma here, various kinds of abuse, substance abuse in the home that children are witness to, mental illness, violence against the mother, and incarceration of a member of the household. So what this shows is that for each one of those, the likelihood of transitioning into adulthood as a fully functioning member of society goes down. Right? The more trauma children experience, the harder it's going to be for them. And some of these adult consequences are pretty severe. Problems with the brain, with learning, with language development, head trauma problems, those are serious, and all kinds of heart, liver, lung, obesity, serious problems. Some of the more socially related, maybe anxiety, alcoholism, smoking, all of these things more likely to lead to earlier death for a lot of these kids when they grow up. And the last one there, heightened likelihood for juvenile and adult criminal behavior. There's people sometimes talk about the school to prison pipeline, and this is part of that conversation. Wraparound is another one of these factors. First was ACEs, and this is wraparound. And wraparound was developed in the 1980s, and there was this talk about sort of de-evolution. Let's deinstitutionalize mental health care, get people out of hospitals and try to allow them to move into their communities. That's kind of the way it started. And then Portland State actually has been right there at the forefront of wraparound. So Oregon does this. There are some states where you probably talk with people in schools or mental health, and they may not even know really what wraparound is. But Oregon's been quite progressive on this. So the general idea of wraparound is, kids present with problems in school, and sometimes they go home. Maybe they go home to chaos. They come back to school. Teachers do what they can. They go home to chaos again. So wraparound tries to help families of kids to help stabilize the home life as well. And sometimes that's not really, that may be just trying to help somebody not get evicted from their apartment. It's not like these are all necessarily welfare services or mental or physical health problems either. It may just be, eviction is disrupting. And there are lots of things like that can be, as well as some of these traumas that go with the ACEs study. Other things about wraparound that make it unique, the idea that it's really team-based. So a family and a child and a wraparound coordinator, a care coordinator, they're often called, maybe somebody from Department of Human Services, somebody from the school. There's a team, and they develop a plan. It's very much a plan-driven program. And so I like that quote that I heard a couple times from people. You know, there are no failed kids. There are only failed plans. If the kid is not doing well, it just means we have to redo the plan. And so it's very much focused on that, and it's evidence-based. So the idea is to learn and to improve over time. And in Umatilla County, here as well in Union, but we don't do it nearly as much here, and we haven't done it nearly as long. It's called CARE. So we do have a couple of students. They're graduates of our program, Bridget Thamert and Sherilyn Roberts, and they are the CARE coordinators, one for LeGrand School District and the other for all the other outlying schools. And that's what they do. You know, they find the students. They don't really find the students, are referred to them, and then they try to help those students and help their families with whatever services they might need. Like there was one case where a kid comes to school and you know, he didn't smell very good. His clothes hadn't been washed in a long time, and so, you know, Sherilyn basically went back to the house, and the mother, of course, was in tears because they didn't have a washer and they couldn't really afford to go to the laundromat. So, you know, that problem was solved by just helping them out. I can't remember if they bought a used washer. Yeah, Rebecca. Well, and here in Union, and it can vary. Their employers are the county commission. The money, though, much of the money comes from the school districts to pay for it. It's a kind of a patchwork. The third trend is this idea of early childhood learning, and I remember when this first happened, because it was sort of upsetting for people in town who were involved with the Commission on Children and Families, which went away. And the Commission on Children and Families did some really good work, right? They would distribute money to whom they felt were deserving nonprofits in town that struggle, because nonprofits struggle. You know, any director of a nonprofit in this town spends most of his or her time just looking for money, basically, and then hopefully they have money to pay staff and that sort of thing, but they depend very much on grant money. But it went away, and then it was replaced by these hubs, these early childhood learning hubs. This came from the Kitzhaber administration, and it fits with the other things. The idea is we got to detect these things early, and we have to deal with early childhood education. And then problems are minimized, or at least reduced, by the time these kids hit adulthood. So it did involve, though, some reallocation of resources. But it makes sense if you think about it. If you're trying to work with kids and you're trying to identify those kids who might have some mental health challenges, where are you going to find them? You know, they go to school. I mean, homeschool changes this a little bit, right? But most kids are going to school, and so the idea is to plunk more resources into Head Start, early childhood, and into the schools. You know, Head Start there, kindergarten readiness, is a real priority for the early childhood learning hubs. And it's more than just education, it's health and safety as well. So we have here the Blue Mountain Early Learning Hub, and they are administered by Intermountain Education Special District, ESD. So I don't know what's going to happen here. Oh, it worked. Nice. So that's what the state looks like. There are a bunch of hubs. We're up here. And then you've got Wallowa and I guess Malheur here. That's a long one. Imagine, you know, that one hub. And it spans the entire north-south length of the state. So there aren't many out east, right? So clearly, in looking at all these things, there's a problem of distance, along with some other barriers that I'll talk about too. Again, 7,300 square miles, 23 communities, 18 school districts. I think there's more than 10,000 children there too. I was just doing the math, and I felt like this comes from the Blue Mountain Early Learning Hub data. But some of the big barriers there are, distance, language, especially Spanish, culture, and social class. This is just a look at the setting and population centers. So there's a couple of big towns, Hermiston, Pendleton, Milton, Freewater, Umatilla behind, and then you've got some smaller ones. It's interesting trying to find the towns on the reservation because they're not in the census. You got to look and explore it. And there's still some missing. Meacham's not up there. There's a few that I couldn't really find. But what I found interesting here was if you look at the total population of Umatilla County, about 79,000, and people who are living in these towns, only about 57,000. So there's a whole bunch of people in Umatilla County who are just not living in incorporated towns too. Distance is a problem. The ones that I wanted to focus on here in green, much higher percent of Hispanic Latino than the national average in Umatilla County. Also, there's a reservation, so we have much higher American Indian, Alaskan Native population, about 3,000 or so. Lower levels of formal education in terms of having a bachelor's degree, and higher poverty, 19 to 13.5% is the national average. So, and none of that's really surprising for a rural area. We had this problem, right? Because we got $5,000 to do a comprehensive study like this would probably take, I don't know, $100,000, $150,000, a bunch of research assistants, and 3 years, a minimum, to try to do a full-blown case study. So, what do you do? Because part of this was not just the research, and Terry understood that well. He understood we're experimenting here. We're going to see if we can do this curricular integration and learn something in the process. And I, I'm very grateful to Terry for his support and for the administration's support on this as well throughout this process. So, there's a couple of ways that anthropologists slice up inquiry. There are all kinds of ways, right? But one way to look at this is the, two views of the world, the emic and the etic view. And the emic view is really the researched. These are the people whose accounts we need to have to understand what's going on in the field. But there's also the researcher. And the researcher can take that broader bird's eye view that people aren't necessarily going to do. That's not really their training, to look at the broader social and cultural context. We needed both for this. And so, given time constraints and distance problems, because this was Umatilla County, we decided mostly to use the web and to do some interviews with mental health professionals in Umatilla County. And we had all kinds of a laundry list of other things we would have liked to do. We'd like to do some spatial analysis. Follow-up would involve that, but that's a luxury we didn't have. So it was really a quick and dirty sort of a methodology to get as much information as we could with limited resources. And so in the end, we did a survey of teachers, a really rotten response rate also. That's one of the things that we need to work on, is developing reliable partners and principals who are willing to support this and encourage their teachers to, just go to the link and take the survey. But anyway, I think we learned quite a bit, even though we only got 60 teachers to respond. And for instance, Hermiston School District refused to participate, which was a bit of a problem because they're the most progressive. They're the ones who are doing the most in trying to bring counselors into the schools. And we did, mostly descriptive statistics, and then we did interviews. And we did 11 interviews. It may not sound like much, but if you've done any qualitative research, 11 60 to 90-minute interviews, transcribed and analyzed it's a lot of hours of work. So, and we tried to hit as many key actors as we could in Umatilla County. So Lifeways is the mental health organization in Umatilla. Here it's the CHD, Center for Human Development. Every county has one. Since the state doesn't want to provide its own infrastructure, they contract those services out, and it happens to be Lifeways in Umatilla County. Gobi is they're the payer. They're the ones who decide which services to pay for and what rates of reimbursement will be there. Umatilla Mora Head Start was pretty critical, the early learning connection there. The Yellow Hawk Tribal Center on the reservation. Umatilla County Care, that's the wraparound person, and she's just fantastic. Intermountain ESD, and then we had some private psychologists and also a psychiatrist who visits once a week from Portland. And those were important because the mental health organization in the county only deals with Medicaid-eligible people. So if you don't have Medicaid, you can't access those services, meaning that anybody else, who's got Obamacare or whatever it might be, they've got to find some other way to access services. So this all affects the private practitioners as well as the ones who work for Lifeways. So it was a lot of work to do these. I did the questions, and they were pretty much focused on each person. They were all different, but there were some commonalities. For instance, we wanted to know from all of them what their perspective was on how kids get into the system, how do referrals get made, who do you see, what's your view of the system. And ideally, when you're doing qualitative research like this, it's not counting things for the most part, but you've got these transcriptions, you're trying to find patterns in the data, and you're looking for, at some point, theoretical saturation. And that means you begin to hear the same things over and over again, right? And we didn't get to theoretical saturation, not by a long shot, but we did begin to hear a lot of people say the same sort of things, and there was nothing very surprising about most of it. It's really the problems of distance, poverty, class, culture in a rural community. How are we doing on time? 30 down? Okay. I'll move quickly from here. So we're into findings, and I'm going to talk a little about the teacher survey here. 3/4 of respondents reported that daily they're dealing with mental health issues, or at least weekly. 2/3 believe their schools were not really ready to deal with people who didn't speak English as their native language. And 3/4 believe they were on the front lines of providing mental health care. So, that's not teachers' job. So you can imagine the frustrations, and at the same time the sympathy that they have for these kids who make it really difficult, but that it's hard to get them the services they need. So the question here that this deals with is on top there. The role of the teacher in regard to children's mental health issues is clearly defined here. Most people, 2/3 of teachers disagreed with that. So there's some unevenness among the schools. Now, there were a lot of schools represented in that sample of 60. 29 schools represented. So again, it's not the greatest sample. But I do believe there are some patterns that are reinforced by what we heard from the experts also. These are all Likert scale things, right? So I feel adequately trained to make mental health referrals for children in my class. Interesting that it's pretty evenly split there. So some people did feel confident in making that distinction between behavior and mental health. Some teachers didn't. And it's tough, you know, because, I mean, kids, they got lots of energy. So, you know, trying to figure out what's clinical and what's just behavioral or developmental, that's not easy to do. Okay, on the left here, I've received training in the last 3 years to help me better identify signs in students of physical, emotional, or sexual abuse. Almost 3/4 say yes, and that's good. Teachers are mandatory reporters, and that's really important. On the right, I feel comfortable distinguishing between normal behavior problems in the classroom and those that might represent more serious mental health. 2/3 said yes, which is different than the previous slide. You know, it was sort of a validity test of the idea of teachers' confidence, and the results are inconclusive on that. But it was a small sample, so that's sort of to be expected. Another question, and this was open-ended: if you were given a substantial sum of money, how would you use it for mental health? And this is an amazing number for an open-ended question. 34 out of 50, you know, that's over 2/3 said they want on-site mental health counselors. That means in the school. That's the direction the county's headed, but they're a long ways away. And when you look at those other numbers, you know, while I only focused on the big numbers, when it comes to mental health, any numbers, any percent is a problem, because that means there are kids that are going unflagged who probably need help. So, more programs in the schools, and a variety. You know, this is more like high school: substance abuse, depression, social behaviors, bullying, but not just. And also, this is support for wraparound, you know, family support mechanisms. Those were the things that came out of open-ended comments of the teachers. And then there's just frustration. So at times, learning has to take a back seat to just maintaining a safe environment in the regular classroom. Very often, the kids that need mental health services are the kids whose families can least afford it. I don't really think they were trying to say that poor kids suffer mental health more often, but you know, if there aren't resources, and mental health resources are scarce to begin with, who's going to have the last and the worst access? You know, people without the economic means, or people that suffer from language or cultural barriers or distance as well. Those 22,000 people who aren't living in an incorporated town or some of the outlying school districts too. Another teacher talked about Native Americans and how difficult it is sometimes when they're in a school in Pendleton or something to gain the trust of families. There's a cultural barrier there. So, again, a lot of this has to do with, we'd like to be able to teach, but it's hard because the kids act out, and they probably shouldn't be in the regular class because we can't teach the other kids, although we understand their plight. Now, some of the things I think that we can conclude from this are that Umatilla County does pretty well considering the issues that they face. There's a lot of organizations that are doing work that's public, private, and nonprofit. And one of the keys is they don't always coordinate well. There's nobody to serve that coordinating function. I felt like the wraparound people were the best to do that because they talked to everybody. They knew everybody, every player in the county they knew. I was really impressed with them. But, you know, things are moving in the right direction. And the usual suspects are here, right? The ones that we interviewed are the ones that are the key organizational actors in the county. What Pendleton Academies decided from all this was psychiatry was an important need because there is only one child psychiatrist in the county, and he comes once a week, and that's not enough. So if you have a system where the psychiatrist gets used only for the most severe problems, or you have medication needs, things like that, there's a need to triage and make sure that wraparound can handle the things that don't require the psychiatrist. There are also other options in terms of what's called telepsychiatry, right? If you needed to manage medication, for instance, you can use computer and information technologies to do that sort of thing. So there are other investment opportunities. School policies are uneven. Some are doing a great job. It's clear from the teacher survey that some of them don't have that as a priority at this point in time. And then, yes, what we suspected from the get-go, that we would have language, cultural barriers of distance, and social class, turned out to be true. So further research should involve more about the users of the system. And we just didn't have time and resources to do that sort of thing. We had planned to do focus groups in outlying communities, and there was just no way. It takes a lot of organizing up front to be able to pull off. We need to know more from teachers' point of view, what's going on. Gender differences is interesting because I did serve on the board of the Grand Run Child Center for like 6 years, and so I'd see the census. I'd see the kids who were in the program, almost always boys. And I don't think that, mental health issues are distributed very unequally by gender. But what happens is the boys tend to act out more. They're more aggressive. They're more disruptive in the classroom, therefore more likely to get the referral into a psychiatric treatment program. And those girls who may have similar issues that need to be dealt with, they're not as disruptive in the class, and those issues may come out in later years. Some of the manifestations of not getting that treatment early on. It's an interesting line of research that I'd like to be able to work on at some point. Also, I just think that telehealth has a lot of potential here to address some of these distance barriers. These are just crazy ideas, right? I mean, I know how crazy teacher training is in terms of a tightly wired curriculum. Head Start should be fully funded. Teachers should have all kinds of training opportunities once they're in the field, and they're seeing this stuff almost on a daily basis, and wraparound has a big role to play in this. These are all good signs. I wanted to mention real briefly the structural idea, because the mental health organization, there were great individuals there. Everybody talked about how good some of the therapists were, but there's clearly a class barrier going on. And so, it's a middle-class institution with middle-class professionals, and, I don't know, a lot of you know how that works. You go to the PTA and the parent-teacher stuff, and you know who goes. We all know who goes to those things. It's those middle-class families who have the time and the resources, understand their kids are going to go to college, right, whether they want to or not. And so, that's what happens, right? And then this creates sort of this gap, this chasm, and potentially mistrust of bureaucracies. And I think it's not totally dissimilar from what happened in Malheur County with the wildlife refuge. It's, whether you agree with people's points of view, you have to try to understand them and why they might be mistrusting of bureaucracies. And, sociological theory goes way back on this to different kinds of authority types, a reliance more on tradition and culture versus a rational legal sort of world of bureaucrats, rules, laws, formal procedures, things like that. So it's clear that the rules that govern access need some work. If this organization, and this is the irony, right? The organization that is supposed to deal with poor people who are Medicaid eligible fails in many cases to do a good job of that. That's a tragic irony in the end. So that's I mean, that's just more part of that. Gobi has a big role in all of this because they pay for this stuff. They get to decide what they're going to pay for. Right? So you can't really exclude Gobi. I saw Gobi say, we're not going to pay for residential, and then we're not going to pay for day treatment. We're going to put people in schools, and then we're not going to pay for the school anymore. We're going to give it all to the mental health organization. And that happened over the space of about 4 or 5 years. And Gobi's not the bad guy here. It was budget cuts, things that are happening at some higher level. And they have to figure out how to manage a shrinking budget. So real quickly, I think there's great opportunity to produce knowledge at a place even of our size, but it's not going to be driving a Cadillac around. There are limitations to this sort of thing because we're not just trying to do research, we're trying to incorporate students into the process too. And there are great opportunities for students doing this. All three had really, it was so clear how much they learned from this process, and one of them got his job largely because of the experiences he had and how he was able to talk about it in his interview process. But you got to have good partnerships to pull it off. You got to have principals who are willing to let their teachers or encourage them to fill out a survey, for instance. That's a longer-term process of cultivating ties in the region. Again, you can do discrete projects or ongoing initiatives. The initiatives are great. That means scaling up, and it means perhaps making sure there's a goodness of fit between the structure of an organization and its function. If we want to do that stuff, we're going to have to be really good at outreach to make sure that regional partners are satisfied with what we're doing and we're satisfied with their role in that process. Okay, I got to say this. We've got a new era coming, and it's not going to be good for poor people. If, for instance, the Congress right now is talking about turning Medicaid into a block grant. And block grants that means you go from, if people qualify, they get it, to there's a lump sum of money, states get to decide how to use it, and when it runs out, it's gone. Right? So that works fine when the economy's going well. It doesn't work well when the economy's not going well, income tax revenues go down, and government doesn't serve that counter-cyclical function of trying to provide a safety net when people are out of work. So this is just something to keep track of, but all these great things that I think are happening in Umatilla County and potentially Union County, they don't necessarily have to go in that direction forever if there's not the support to make that happen, and there has to be money to make that happen. So that's a question, right? Where are we going with grant funding? Are we going to fund prisons? Are we going to fund schools? Are we going to fund mental health? Because if you go to the jail, you find the same thing. Lori Lucas will tell you 1/3 of the people in there shouldn't be in jail. They should be in a mental health treatment program. So, I guess in the end, the trends are really good, right? But the challenges are awesome and never-ending. Thanks. Questions? Nancy? How dare you start without the microphone?
I'm interested in the small schools issue because this seems to be partly an issue of scale, and if the money is funneling into the schools, did you collect any data associated with big school districts versus small school districts?
Well, the big ones obviously have more money, and the small ones are likely going to have a patchwork system, pool resources, maybe have a circuit rider who's not there every day but can get there soon, and potentially use some kind of telehealth practices for some things that might work. We just didn't get enough from schools. I did a survey of school administrators, and we did one for clinicians too. We ran out of time. We tried to administer the clinician survey, or the administrator survey, and we only got 2 people to apply. That's back to that idea of partnerships. They have to be built from the ground up, and that could take a half a year or a year, and they have to see results to decide they want to keep involved too. So yeah, I don't have really good information, just theory suggesting that size and distance are problems. Uh-oh. Make sure it's the one I told you to ask, Peter.
Two things. One, is there something to learn from that, the refusal of Hermiston to participate? And 2, you mentioned how when you looked at the candidates or the people in a program, they were disproportionately boys, and and your interpretation was women, girls were
That is my
underrepresented.
interpretation.
And
Yeah.
my question is it possible, or did you consider the possibility of boys being overrepresented? Which would...
You mean not? Well, I think most of the kids that I saw, I didn't really see them, but I'd see the census. They had multiple diagnoses. They might have oppositional defiant disorder, bipolar. They were kids who needed services. We're underserved in a big way. Boys are, no doubt. I think the boys are underrepresented too. The girls are just more underrepresented. But that's just, based on my own take. How would you know, right? Who's not being diagnosed? We don't have that data. Yeah.
What about Hermiston?
Well, that's hard to say. But the superintendent had no interest. I tried to use 2 people from the board. We tried to use opinion leaders in Hermiston. We tried by hook and by crook. And he was just, he was not going to participate, and he was not going to allow. And I kept saying, look, all you got to do is provide this link. And they could decide they could do it at midnight. It's not like they're doing it on the job. So, there is an education component here to this kind of work, and trying to help people say it's in your best interest to learn about this. And Hermiston would have shown, I believe, shown without the W, right? Because I do think they're very progressive and spending money in the right way.
Hi, Bill. My experience from a few years ago when we did a similar kind of project with myself and OHSU, what we started doing beforehand, before we went out to do interviews, and we ended up, as you know, interviewing over 700 people, is that we started going to the meetings where superintendents went together and we presented probably 2 or 3 times. At the beginning, almost none of them wanted us in the schools, and then they started catching on to how this will benefit them. So that's what I would suggest doing moving forward, is find out when they meet, get on the agenda, and just start meeting them there. Other thing is that I really like the idea of interviewing the kids. They don't often get interviewed in surveys, and so I think
For
moving
reasons
forward it'd be good.
Of a vulnerable population, things
Yeah.
like that. And we didn't have time to go through a human subjects
Right.
review of that. But
Yeah.
that would have been ideal, obviously, or at least some observation.
Yeah, and at least from when I did it, we had the boys together and the girls together, and it was some pretty interesting, frank conversations. So I wouldn't put that aside.
Yeah, I'm somewhat familiar with the amount of funding and resources you had for that study.
Yeah, it was a lot.
And, we didn't. And that's why I do think that a lot of this, you do have to be clever and resourceful. Not that I'm that clever or resourceful, but it certainly helps, because you've got to make lots of methodological, not really optimal methodological decisions along the way. Rebecca.
In terms of that, how did you deal with that in terms of your students? You clearly understand the difference between how you might want to approach a project like this and how you had to, given
Yeah.
the constraints. How do you communicate that to students?
These 3 students?
Right,
Or just
because
in
they're
general?
learning a lot,
Yeah.
right, through this project, but don't you also want them to learn that this maybe isn't the optimal approach that they would want to take as they move forward? Is
Yeah.
that something you dealt with?
Oh, we would meet regularly, and they knew it was sort of seat of the pants. I mean, there were times where it's like, I just got an interview schedule, I'm leaving in 20 minutes, and we'd have to crank out interview questions in 20 minutes. And I'd done it so many times, and they'd sit there like, wow, how do you do that so fast? You know, because if that's what you do, you can do it, right? But I think they sort of got a view of how research happens when you're resource poor. And I do think what we did was of great value, of great value to me in understanding rural communities and the integration of schools. And I feel like Umatilla County is doing all the right things. All right, so I'd love to do a follow-up with other students. One of the other problem, Linda, was obviously it was Umatilla County. So we got the blues, and we did some of this during the winter, too. It wasn't nearly as bad last year and the year before.
Assuming that these 3 students didn't speak Spanish, how useful would that have been in this research?
I think in terms of what we did and who we talked to, not. But if we were going to do a full-blown study, definitely. We did try to talk to a couple of people who had been hired as bilingual therapists to get their take on it. So, I mean, about the best we were able to do is identify it as an issue, and we know it's a serious issue, and the teachers know it, too. I mean, I think some schools are doing fine. They're doing a pretty good job, but there are others where, you know, the kids just aren't going to get the services, and who can blame the teachers for not being qualified to make a, you know, snap decision that somebody needs to be referred for mental health care rather than just go into a suspension or go to the principal's office. You know, those are tough, and language just complicates it further, and culture. So kids from the tribes, you know, it's a whole different kettle of fish. And the woman we talked to at the Yellowhawk Center said there were a couple of individual therapists that she had a lot of respect for, and they weren't from the tribe. She said it's just more important that they have some cultural fluency. Yeah, those are obviously big problems.
Bill, first of all, I want to thank you for the presentation. And more importantly,
Thanks for coming.
thank you and all the people in the world that do this kind of work. I'm thankful for that. I just think about my career in terms of engineering and project management and operations management. And other than where you're interfacing with people, it's formula-based, you know. And I don't see any formulas in this where you just put it in and crank it out. It just sounds really complicated and difficult. So thank you.
Well, you know, I mean, I would say first off that some of the people we spoke with are they're heroes. Like the woman who does the wraparound in Umatilla County. I would pay her twice what she gets because she was that good. And in fact, there was some pushback because at the end my recommendation was take this person and make her the coordinator that pulls together this system in the county. You can appreciate systems thinking, right? You need somebody to coordinate. They didn't like that idea very much, and she didn't want to do that, and you know, I understood that. What can I say? But it's gray areas. It's a lot of gray areas. That doesn't mean it's not social science, though, because it is. It's just you know, humans are pesky critters, and you know, we do the best we can with the resources we have.
So a couple questions I had. One was where you were talking about the children pulling them into classrooms or out of classrooms. You said it was a debate. I can imagine that it is. I would like to hear your perspective on that. Also, you talked about investing where there was the greatest promise for return. You know, what's the measurement there? Is it length of life for these individuals, or how do you know that you're getting that return?
Well, obviously, longitudinal studies are really expensive. I think what I would do is that the evidence suggests that early learning programs work, right? So anything you can do. So you would look for numbers, I think. You'd try to find evidence that more people were brought into the system and had good outcomes, and their attitudes about the system were better, you know, and they were less mistrusting of the bureaucracy. Those would be indirect measures, but proxy measures, but maybe, the best you could do. I'm sorry, your other?
Push in, push out.
Oh,
class.
I'm not the one to ask. I'm not a teacher, but being on the Grand Ronde Child Center board, it was clear that it was going to be push in, not pull out, because pull out was more expensive. And now teachers will say, no, they need to be here until they're ready to be here, because otherwise we can't do our job in the classroom, and if you can't educate the kids, then, really, what are you doing, right? So it's, again, there's no clear black and white.
So decisions are being made on money right now.
I think so, yeah. Budgetary matters that mean that residential care and day treatment centers are more expensive. I'm sure it's past 5. I'm sorry.
Almost 5.
Oh, well, forget that then. I take that apology back. Nope. Okay, well, thanks for coming. Appreciate it.
Thanks.